Hi, I'm Dr. Srividya. I am a lead consultant and a neonatologist at Motherhood Hospital in Bengaluru. NICU Live ಅನ್ನೋ ಕಾನ್ಸೆಪ್ಟ್ ಏನು? Why is this innovative program even developed? Neonatal mortality ಅಂತ ಹೇಳ್ತೀವಿ. ನವಜಾತ ಶಿಶು ಫಸ್ಟ್ ಡೇಯಿಂದ 28ನೇ ದಿನವರೆಗೂ ನಿಯೋನೇಟ್ ಅಂತ ಕರಿತೀವಿ. ಇಂಡಿಯಾದಲ್ಲಿ ಮೋರ್ ದ್ಯಾನ್ 20% of the babies who are born die within this period. Initial 24 hours-ನಲ್ಲಿ ಅವರ ಮರಣ ಆಗುತ್ತೆ. ಯಾಕೆ ಆಗುತ್ತೆ ಅಂದರೆ a lot of them we do not have enough human manpower to intervene the process that is happening to save these kind of babies' lives. So this program is developed mainly to bridge a gap like this where the human resource is lacking. There are not enough hands to cater the needs of developing mortality, and there is also a lack of understanding of why these disease processes are happening. So NICU Live program now main three components are one, the visual monitoring where high resolution cameras are put up in the NICUs. We partnered NICUs and the various across the country, different centers of they are partnered with us. Where we put up the cameras in their unit and we are able to 24/7 do a live monitoring of the babies through these cameras virtually. And the second component is the data management. Data management ಅಂದರೆ ಇವಾಗ ಮಕ್ಕಳಿನ ವೈಟಲ್ಸ್ ಅಂತ ಹೇಳ್ತೇವೆ, ಹಾರ್ಟ್ ರೇಟ್, ಬ್ಲಡ್ ಪ್ರೆಷರ್, ಟೆಂಪ್ರೇಚರ್ ಇದನ್ನೆಲ್ಲ ಹೇಳ್ತೇವೆ. ಸೊ ಇದೆಲ್ಲ ಬೇಬೀಸ್ ಡೇಟಾ. ಸೊ ಎವ್ರಿ ಟೈಮ್ ಎವ್ರಿ ಅವರ್ ವಿ ಆರ್ ರೆಕಾರ್ಡಿಂಗ್ ದೀಸ್ ಟೆಂಪ್ರೇಚರ್. ದೀಸ್ ಡೇಟಾ ಇಸ್ ಗೆಟಿಂಗ್ ಲೈವ್ ಫೆಡ್ ಇನ್ ಟು ದ ಡಿಜಿಟಲ್ ಪ್ಲಾಟ್ಫಾರ್ಮ್ ದಟ್ ವಿ ಹ್ಯಾವ್ ಪಾರ್ಟ್ನರ್ಡ್ ಆ್ಯಂಡ್ ಡೆವಲಪ್ಡ್. ಸೊ ವಾಟ್ ವಿಲ್ ವಿ ಡೂ ವಿತ್ ದಿಸ್ ಡೇಟಾ? So ishtu information inda we have also incorporated artificial intelligence into this platform, which will trigger an alarm for us as to what kind of babies might go into critical period, what kind of babies will go into more sickness phase. So hangagi we are able to pick up on the early signs of the baby which might go into a more critical phase than what they are, and we are able to intervene and give them the right kind of medication and the procedures to help them recover faster and better. So communication ಹೇಗಾಗುತ್ತೆ between us and the spoke sites ಅಂತ ಏನು ಹೇಳ್ತೀವಿ who are partnered with us, we always have a 24/7 virtual call that is going on. ಈ ಕಾಲ್ನಲ್ಲಿ one of the doctors from the motherhood, one of the nursing from the motherhood, and the nursing and the doctors from the spoke site, ಇವರು 3 ಜನ 24/7 ಲೈವ್ ಕಾಲ್ನಲ್ಲಿ ವಿ ಕೀಪ್ ಕಮ್ಯುನಿಕೇಟಿಂಗ್. ಸೊ ಕಮ್ಯುನಿಕೇಷನ್ ಇಸ್ ಅನ್ ಇಂಟಿಗ್ರಲ್ ಕೀ ಫಾರ್ ಅಸ್. ಈ ಕಮ್ಯುನಿಕೇಷನ್ ಮುಖಾಂತರ ವಿ ಆರ್ ನಾಟ್ ಓನ್ಲಿ ಟೆಲ್ಲಿಂಗ್ ದೆಮ್ ವಾಟ್ ದೇ ಕ್ಯಾನ್ ಡೂ ಬೆಟರ್, we are also picking up on the certain not to like to call it mistakes, ಅವ್ರಿಗೆ ಗೊತ್ತಿಲ್ಲ ಅವ್ರು ತಪ್ಪು ಮಾಡ್ತಾ ಇರ್ತಾರೆ ಅಂತ. ಸೊ ಆ ತಪ್ಪನ್ನು ಕಂಡು ಹಿಡಿದು ಹಿಂಗಲ್ಲ ಹಿಂಗೆ ಅಂತ ವಿ ಟ್ರೈ ಟು ಕರೆಕ್ಟ್ ದೆಮ್ ಆ್ಯಂಡ್ ವಿ ಟ್ರೈ ಟು ಎಂಪವರ್ ದೆಮ್. ಸೊ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ದೇ ನೋ ದ್ಯಾಟ್ ವಾಟ್ ಎವರ್ ಐ ವಾಸ್ ಡೂಯಿಂಗ್ ರಾಂಗ್ ಅಂತ ಹೇಳಿ ದೇ ಆರ್ ಸ್ಟಾರ್ಟ್ ಡೂಯಿಂಗ್ ದ ರೈಟ್ ಥಿಂಗ್ಸ್. ಸೊ ದ ಮೇನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಶ್ಯೂ ದ್ಯಾಟ್ ಇಂಡಿಯಾ ಫೇಸಸ್ ಇಸ್ ದ ಇನ್ಫೆಕ್ಷನ್ ಕಂಟ್ರೋಲ್. ಅ ಲಾಟ್ ಆಫ್ ಬೇಬೀಸ್ ಡೈ ಬಿಕಾಸ್ ಆಫ್ ದ ಇನ್ಫೆಕ್ಷನ್, ಸೆಪ್ಸಿಸ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ಇನ್ಫೆಕ್ಷನ್ ಕಂಟ್ರೋಲ್ ಅನ್ನೋದು, because it is a huge problem, our main focus is to ensure that the infection rate becomes lesser. So nursing empowerment, meaning trying to empower the nurses by educating them, ಅವರಿಗೆ information ಕೊಟ್ಟು, education ಕೊಟ್ಟು, how to treat their babies better ಅಂತ ಹೇಳ್ಕೊಟ್ರೆ, that is the first line of success that we will get, that they will be able to treat for their own babies in a better way. They will be able to pick up on the early signs and tell to their own doctors, raise a red flag that their babies are not doing well, and also understand the conditions and different types of managements that the babies can undergo to get a better care. So this is the overall solution we have tried to program in a very innovative way, which can reach without having any boundaries, which can reach to any remote location of our own country or even beyond the country. So we are looking forward for more work in this current field. Thank you.
Hi, I'm Vijay Ratna, CEO of Motherhood Hospitals. Today I'm here to talk about the Motherhood initiative, NICU Live. NICU Live is an initiative that is started with a very clear vision of helping children, newborns specifically, in the rural areas who are, as of today, not able to access a very high-end critical care from these rural areas. Motherhood Hospitals has come up with this initiative of NICU Live, through which we can equip and both technologically as well as we can provide the clinical expertise from our hub, which will be in any of our hospitals, and help the spoke hospital nurses and doctors to deliver a very high-end care to the sick newborn babies in those regions. We have so far treated 300 babies through this system, and we have been able to deliver exceptionally good results, which is comparable with any of a very good physical neonatal intensive care unit system that can provide. So we are very confident and we are very eager that now that we have, on the back of the results that we have delivered, we are very keen to expand this program to very many locations, and we have a very clear vision of treating about 10,000 children in the next 3-4 years, and that's our objective, and we are very keen that this technology is going to be a big boon in the area of neonatal intensive care unit. Thank you.
Neonates means babies who are born and who are just less than 28 days of life. We have seen in India unprecedented number of babies dying because of lack of resources, lack of expert medical staff looking after the babies, and lack of infrastructure. So there's almost about 7.5 million live births that happen, and then quite a lot of, almost 28 babies per 1,000 are dying in India. And majority of these babies are dying in rural setup or in the remote areas where you don't have enough infrastructure, you don't have enough manpower to look after, especially the expertise. So in order to sort out this problem, Motherhood and the doctors in there, we joined hands together to build up a platform called Radar, which is a technology-based platform wherein we can remotely monitor these babies in the NICUs, which are situated in the remote areas all across the country. So far, we started doing this and piloted this program, making sure that we are responsible enough, making sure this program runs really well and seamlessly. And overall, we are now looked after more than 300 babies over a span of 1,500 NICU days. To deliver this, you need a seamlessly good technological backup. So with the Radar system, we have high precision cameras which are linked to big data, machine learning, and artificial intelligence. So what does this do? This camera can zoom in to look at the babies, and then we will be sitting in the hub area with a lot of clinical expertise and looking after these babies 24/7. When a baby is unwell, when a baby is becoming unwell, we would be also able to predict when this baby is becoming unwell, and at the same time we'll be able to alert the clinicians who are there in the spoke side, which can be anywhere in the remote areas. So by doing this, our main aim is to reduce the neonatal mortality rate, which stands at around 28 per 1,000 at this point in time, to single digit numbers. And we are able to do this only by marrying the technology as well as the clinical expertise. Thank you.